Think prevention, live long.
I'm Dr. AJ Shah. I'm going to explain you about how the stress test works, how we interpret the results, and what you should know as a patient. When a person is having concern for the heart blockage, the stress test is one of the most common tests we use to find out whether a person has a serious blockage or not. In your case, you already had a stress test done, so let me explain you how the results are going to be interpreted for you. Once you had a stress test, whether it was a chemical stress test or a walking stress test like on a treadmill, the heart is put under stress, and when heart is put under stress, it requires more blood flow. And if you have a heart blockage, the blood flow is not going to be there. And that part of the heart where the blockage is not going to get the blood and is going to ask for help. When that part of the heart asks for help, on the electrocardiogram, there will be some changes, and I'll explain it, I'll show you those changes as we talk. If you had pictures of the heart done with a nuclear camera, those pictures will also show lack of blood in that area where the blockage is. If you had an ultrasound of the heart done, the ultrasound will show the same concern for the blockage and the muscle, part of the muscle not getting blood in that area. So again, when you have had a stress test, the stress test will show us if the blockage is there or not. Most of the time when we see the concern for the part of the heart not getting enough blood, the blockage typically is above 70%. So again, when we see any changes either on electrocardiogram or on the pictures of the heart, we have to assume the blockage is above 70%. Now, I want you to understand, when we do the stress test, we are not looking at the blockage itself. We are looking at the effects of the heart blockage. Again, we are looking at the effects of the heart blockage on your heart. Stress test does not look at the plaque itself. It looks at the effects of the plaque on your heart. And the way I explain to all the physicians I work with and all the patients, that at the end of the day, it's the effect of the blockage more important than the blockage itself. And the reason I say that, because when the blockage happens, heart starts making new blood vessels around that blockage, almost like a detour when we have constructions on an expressway. So when a blockage happens, heart starts making new blood vessels around that blockage. And I've seen many cases in the last 25 years when the blockage is 80-90%, but the new blood vessels are formed, and that 80-90% blockage does not even show up on the stress test. So again, we are more concerned about the effects of the heart blockage on the heart muscle more so than blockage itself. Now, once we prove that effects of the heart blockage are seen on the stress test, either on the electrocardiogram or on the pictures we took, most of the time nuclear pictures, we have to make a decision whether the blockage is enough concerning, or blockage is doing enough of effects on your heart and on your daily activity, whether we should do the cardiac catheterization or not. So let me repeat again what I just said. Once we do the stress test, if we see a very large concern on the pictures of the heart, and if you had a lot of chest pain, a lot of fatigue, a lot of shortness of breath, we will go ahead and probably schedule you for cardiac catheterization. On the other hand, even if we see some minor concern for heart blockage on the pictures of the heart after the stress test, many times the goal will be to build new vessels around that blockage with exercise, diet, cholesterol control, taking aspirin, blood pressure control, not smoking. And if we do that many times, actually we can completely avoid the cardiac catheterization. So let me sum it up. You already had a stress test. You are here for the results of the stress test. The stress test shows the effects of heart blockage to your heart and to your body. If we see the effects of heart blockage in a very concerning, very large way, you probably will need cardiac catheterization, and we'll make the decision together. On the other hand, if I see the effects of the heart blockage is only minimal, then good chance we'll work with medications, exercise, diet, quitting smoking, taking aspirin. And if those things work, you will never need cardiac catheterization. But if the symptoms happen, if you get more chest pain, you get more fatigue, more short of breath, you eventually, possibly, could require cardiac catheterization. So let's work together to see if we can avoid cardiac catheterization by all means. Thank you, and I'll see you in 10 minutes.
When we think prevention, live long, the heart of mid-Michigan strong.